Good evening and welcome to tonight's edition of The Probe. Have you been to a government hospital recently? What was your experience at the laboratory? Were you even attended to by these laboratory technicians? Because we know that there's a strike currently in force. Tonight, we're probing the issues that have come up when it comes to the issues about laboratory physicians versus medical laboratory scientists. That's what we're probing tonight on the JoyNews channel. Were you even attended to? What was it like? You need to get interactive and share your experience with us. It's doctors versus laboratory scientists and the TEF war. It's time to gather around as we seek a solution to these issues that dates back to as far as 2013. Who has the right to operate in the lab is the key question. Who regulates activities in the lab? Who heads the laboratory? Tonight we have the medical laboratory scientists on one side and the laboratory physicians on the other side. The National Labour Commission also attempting to resolve the issue following the full-blown strike embarked on by the lab scientists. What exactly is the Ministry of Health doing about the situation beyond the mere calls for calm followed by talks? Tonight, we probe the real reasons behind the TEF war while asking if it is a needless battle. We're live on the JoyNews channel, Joy 99.7 FM, Love 99.5 FM, and a dozen affiliates across the 16 regions of Ghana. On DSTV is 421, GoTV 144, myjoyonline.com, and all social media platforms. Please leave your comments there. We are back shortly with our guests, and then we get talking after this quick turnaround. I am MFR Pao. Please stay with me. Welcome back to The Probe, and tonight my guest for the show, Dr. Nanayaw Efriye, is the chairman of Parliament Health Committee. We have Dr. Dennis Edujesi, PRO, medical and laboratory scientist, joining us via Zoom. We also have Dr. Justice Yankson, the General Secretary, Ghana Medical Association, GMA, in the studios with me tonight. Welcome, Dr. Justice Yankson. Welcome, Dr. Dennis Edujesi, and welcome, Dr. Nanayaw Efriye. Well, we're supposed to have the Executive Secretary of the National Labour Commission, Mr. Ofusu Asamoah, joining us tonight, but at the last minute, just before I came in, he's had to pull out for reasons best known to him. My apologies to you, the viewers and listeners, for that. But as and when they agree to join us, they will. That's the National Labour Commission. But welcome, gentlemen, to the probe tonight. We'll have to test on Zoom.
Okay. Yeah, hello. Yeah, good evening, MFR.
Thank you very much for your time tonight. That's Dr. Nanayaw Efriye, I suppose. And then Dr. Dennis Edujesi.
MFR, at one point that you becomes Yao. I think we should keep it a you.
I think a you. Okay, great. That's fine.
Very often than not, I have my name changing a you to become Yao. Very often. I don't know how, at what point it ends.
I'll keep it that way. My apologies, Dr. Nanayaw, you, Efriye. We're grateful. And Dr. Dennis Edujesi.
Kwame, I can be Yao, so it's Nana you.
Okay. Dr. Edujesi, and I can't see you. And I can't see, Honorable, I can't see you. And I can't see you.
Yeah, MFR, at this point in time, at an undisclosed location.
Okay, okay, we keep it that way then.
It has gotten so because the medical laboratory scientists, they've gotten me to find myself to meet I think 3 of their leaders in this undisclosed location, and for that matter, I'm unable to turn it on. I'm sorry about that.
That's fine. And what's this meeting about? I'm sure it's about the current situation that we are faced with. Are you able to tell us where we are?
Absolutely. It was supposed to be a meeting in the afternoon, but they are the strikers, so we are there to listen to them and to serve them. So
perfect. So before I come to the striker, Dr. Justice Yankson, just coming in from Koforidua after that fiery press conference earlier, and I see you have a copy of your communique as well. I hope all is well.
Very well with us.
Okay, great. The striker, Dr. Dennis Edujesi, I hope all is well with you at your end. Are you still on strike?
Thank you. As far as I know, the strike had been declared at the respective regions. So as far as my monitoring now is, the lab scientists in the various regions and the chapters of the tertiary hospitals are still on strike.
In spite of the NLC directive, in spite of the court order asking you to call off the strike?
Well, I don't have any communication from National to that effect. What I know is that the NLC's directive was to the Confanoche chapter. I've not had any communication from there. But I'm saying that the other regions, which is all 16 regions and the chapters of the teaching hospitals, as far as I can confirm, none of them have actually withdrawn their labor action.
So it looks like you are defying the court order and the directive from the National Labour Commission. Is that what it is?
No, I don't think that's the case. And before, I think the directive was to Confanoche chapter. In any case, there was even a mistake in the name of that particular chapter, but that is nothing to go by anyway. But I have not had a communication from Confanoche chapter of the professional body. But as far as I know, and as we all know, all other regions had given a declaration, and I'm aware they are still on it.
Okay, but to what end is the question that most people have posed a whole week? Have you achieved what exactly it is, for which reason you've gone on strike?
I think the fact had been that you've posted some laboratory physicians, some lab medics to be part of the staff of the laboratory in hematology. And professionals had given indication that, yes, these are respected professionals. They have their line, they have their structural line of development and progress. They have it up to whatever apex you may want to talk about it. They can't be part of us. If you are talking of the staff list in Confanoche laboratory, hematology for that matter, we can't accommodate these two. And for that matter, they have to be taken out of our list. Go for the organogram, and you see that the number of personnel in the lab, the two physicians are part of the staff. They are not part of the other medical doctors. And that is what the guys are saying. They can't be part of us. So it's nothing about lab space. And we keep confusing it and trying to throw dust into the eyes of the populace. It's about organizational structure.
So organizational structure, like you put it, then why should me as a patient suffer for all this? Because you're on strike not because of allowances, you're on strike not because of your payment. And as a patient, I go to the hospital and I have to suffer for it. Is that fair?
No, MFR, that is probably the other question you may also want to ask is it also fair that we cannot also progress in our line of duty, that we always need supervisors?
So why should we be punished for your insecurity? Why should we be punished for your insecurities is the question.
It's not about punishing, but it's just about our employer. As DMA says, the Confanoche Teaching Hospital is the employer. They have the power to appoint, the power to assign, and for that matter, they have taken who they desire to do so. Okay. So if they have professionals who can run the lab, and the lab says that come and take over, I don't think that should be a problem at all.
Okay. Well, we'll have audience questions, a lot of them. We'll get into it. But before I come to Dr. Justice Yankson in the studio, I'd love to hear from the chairman of Parliament Health Committee, Dr. Nana Ayew Efriye. Well, so what's your own reading from where you sit in Parliament on all this? What kind of briefing have you received? We're yet to hear from the Ministry of Health. We know there was a communication, but what exactly is the official briefing you're getting from Parliament on this particular issue?
Yeah, Amifa, thanks for this question. If officially we have not had any submission or petition to ask for that matter, the joint press conference that was held by the majority and the minority, that's the chairman and the ranking on the committee, as we said to the press, was as a result of the feedbacks MPs are getting from their constituents, and for that matter, as the people's representatives, we needed to speak on the issue. And that is exactly where we expressed our frustration, disappointment in the Association of Medical Laboratory Sciences, that we have worked with them so much, especially last year, where we had to see that in the Teaching Hospital Amendment bill, we would have to include them so that they have allied health professionals being represented on the teaching hospital boards for the first time. They had frustrations all over, and this is something they sought for over a decade. And they came to the health committee, we understood them, and we stood by them, and we justified why they should be included. So we thought in a very sensitive issue as this, especially where it does not bother on their conditions of work, something very sensitive, but then it's administrative. And then also there is some legislative overlap. As far as I've read from them and heard from them in the news, at least they could have come to us for us to speak on it. And we have had times that we have solved, the other committees in Parliament have solved some of these overlaps with the policy makers. So we are the best friends for them to have consulted us. And so we only came in based upon the feedbacks we got from the constituents, and we didn't think that life should be lost at this point in time. And so as very good friends of the Parliamentary Health Committee, we asked them to go back so that we can be able to get their petition and bring their sides together on Tuesday and then see what else we have to do.
Okay, so you're meeting both sides on Tuesday, you say?
We are basically, the clerk is going to get all of them. The GMA will come, the medical laboratory will come, the CEOs of the teaching hospitals will come, the Minister of Health will come with his team, the Allied Health Council is going to come, and then we are also going to extend invitation to the Labour Commission as well, and it's going to be on Tuesday. So, I mean, basically, we don't have any stance on this issue. We are only speaking on behalf of the people. And at this point, like I said, this meeting I'm going to have with some of their leaders is going to give me the first opportunity to listen to them. However much so the issue has been, I've not gotten them to speak on it. And so we have to speak for the people. They must go back to work. We must also listen to them. And then we must come to a middle ground on the issue. Yeah.
Okay. Well, today, the Ghana Medical Association, like I said, they've been holding a press conference after an emergency meeting they held in Koforidua, and Dr. Justice Yankson has been waiting patiently for his turn before we get into the first batch of questions. So I see a 7-pointer resolution after that, after you pointed out some of the issues that were raised by the NSIT committee. 7 of them, but a key also that I heard whilst the press conference was ongoing was the issues about threats of assault and even in some cases murder on some of your members. But really, what's the GMA saying when it comes to this particular issue? What really is the stance? I see that you're asking that all those who were forced out should go back, and that's the laboratory physicians you're saying. So amongst others, let's go through them. What exactly are your concerns too?
Well, Emifa, let me quickly point something out to my good friend. You see, the people of Ghana are very wise. We don't have short memories. When they started, the very first thing they said was that the 2 clinical hematologists who have been posted to that department ought to leave because they were sent there to head. That was the first thing, and all media houses have this on record. Secondly, they shifted it to the point where they said they envisage that in future, more or less becoming fortune tellers, that these 2 hematologists in future will become heads and that they don't want it. Then later they moved it to they are looking for independence as if they have been colonized by somebody. And now the PRO tells us that it's about organogram. You see how confused and untruth can actually be peddled.
Why is the untruth?
Because you cannot set all of us on a certain mission. The very chapter that started this whole thing told the whole world that it's one, they should leave because they are heads. Then suddenly they said in future they will become heads. And then their Allied Health Council comes, they say we are looking for independence. And now he says it's about the organogram and that they don't have any problems with the laboratory physicians. If you don't have any problems with them, why wouldn't you allow them to work? Look at what is happening in Cape Coast Teaching Hospital. Is that also about organogram? Where the consultant hematologists and the specialists have also been forced out. They have put red bands there and what have you. Now let me go to the murder and bits you mentioned. Is that also about organogram? In Kolebu, somewhere 2016, somewhere 2016, that was where this incident happened. And if you go to the Kolebu police station, these records are there. And we are demanding that the due prosecution be carried out. We cannot continue on this tangent. We will not sit aloof for people to behave in this way, threaten us, and then openly change their stance and basically lie to everybody. This is not it.
For them, whilst all this is going on, they feel that these 2 key laboratory physicians in question should be withdrawn while dialogue can take place.
They should be withdrawn and sent where? They have their lawfully chosen professions. And what it is that they are laboratory physicians. they have every right to work in that space. That is the space that they have worked all their lives in terms of training to be practicing their profession in. If you get up and say they should be moved out, are you saying that they should be denied their livelihoods? What should they go and practice? They should tell us what these two laboratory physicians should go and practice when they are moved out. Can I tell them to be moved out of the laboratory to go and practice elsewhere? Look, in the hospital setup, look at the labor ward, for example. There are two categories of people who usually will work there. The midwives, who are regulated by the Nurses and Midwifery Council, and then the obstetrician or the medical doctors. Do you hear the midwives tell the obstetricians that they should leave the labor wards for them because it is their space? Or do you hear the obstetricians tell them that the midwives that they should also leave because it is their space? Or do you hear medical doctors or the obstetricians tell midwives that because they work in the labor ward, they should go under the regulatory mandate of the medical and dental
There's
council?
a concern about medical doctors hijacking the entire health system.
These are all figments of people's imagination.
How so?
Yes, because it is as simple as that. Where is the hijack? The doctor is responsible for the ultimate care of the patient.
Must the doctor head each and every department?
We are not talking about headship. What I'm saying is that the doctor is responsible for the ultimate care of the patient. It starts and ends with him. In between, all others will come. But the duty to ensure that the patient ultimately gets the right care rests with the doctor. Now, if we are talking about headship, who is fighting with somebody over headship? It is as simple as that. Headships all over the world, whether it's in the medical field, it's in the media arena, it's in football, wherever you find yourself, is based on certain key criteria. One would most likely be your level of education, your competences that you have, both the technical bits and then the academic. Some will also depend on your leadership skills, your ability to bring people together and manage them. There are a lot of soft factors that will come in. There's always a procedure that will be spelled out for appointing people. Usually what will happen is that that top level position will be advertised, and all persons who think that they have the competencies to occupy those positions, either from within or from without, may have the right to go and apply. After you have applied, you may be taken through a certain process. It could be interviews, it could be whatever, and then ultimately the best fit person is put in place.
And that was what was done in this particular instance?
These two people are not even heads to start off with. So that argument is even flawed from the word go. The two laboratory physicians who were sent there to practice their lawfully chosen profession and were not sent there as heads.
Okay.
So we can't even talk about these processes when it comes to them.
Okay, let me bring in Dr. Dennis Edujesi so we can quickly get into some of the questions that have come in. So, Doc, you've heard Dr. Yankson. This issue is not about headships in the first place. They were not sent there to take over the lab, as we've heard you say over the period. So what exactly is the concern? Why are we wasting everybody's time, like people would say?
Right, Emifa, thank you very much. And Dr. Yankson, nobody is confused. Nobody is lying. In fact, such words is not just a prerogative of certain individuals. We equally use some of these words to you. And none of our positions have changed since we started speaking. Probably, just like looking at the elephant by the blind people, whoever had held the tail was telling something different. So that's what probably you might have heard.
So that it means you didn't sell your message well to the people of Ghana.
Can I share a screen to you, please? Let me share some screens, and I think that will, can you please enable me to share a screen?
Okay, my producers will work on that.
I'm disabled.
Okay, my producers will quickly rectify that and work on it.
Kindly help me do that, because
but if you could, whilst we wait for that, if you're able to clarify this issue about headships, what exactly was the information that you got that these two were taking over the lab at Komfo-Anokye Teaching Hospital? What exactly was the communication?
So, Erifa, that's what I was going to tell you, that in 2012, an assessment was done by the Ghana College of Physicians and Surgeons, one of the accreditation processes, and the recommendation by the team that went to Komfo-Anokye. At that time, Dr. Clement Opoku-Okra was the head of the hematology department. And the recommendation, that's why I wanted to show you the letter, so that it's not like somebody...
Your screen has been enabled. You can try again. Your screen has been enabled. Try again.
All right. Thank you very much. I guess I could do that. So,
okay.
So, as I'm just saying, we have had a history. And the point is that when they did the assessment, Dr. Clement Opoku-Okra was the one that was in hematology. And the recommendation that was actually given was that this person needs to be removed. And they need a medically qualified person to come and head the unit. I think you can see it from the screen. There's a letter that was actually signed by Dr. Ivy Ekem, November 2012. And entrance meeting, the various unit heads were introduced, Dr. Clement Opoku-Okra, and get to the point C, recommendation at the exit meeting. And it's just telling you that the apparent scattering, underutilized, and deficiencies can be solved by a dedicated medically qualified hematologist as head to put all the things together and get whatever they desire in that particular department. This is the department we are talking about, hematology department in Komfo-Anokye Teaching Hospital. Fast forward, you have these people, the two doctors who came in from training. They were initially at the blood bank, came back from training. They were in internal medicine. And when you go to internal medicine, they were further posted to go to the hematology department. This is the internal medicine posting for these people. And they were asked to be released to the hematology department. And the hematology department acting head, who is now a med lab scientist, was asked these people to report to him. And they reported to him. So that was where the signal was caught that this is a recommendation. You are working towards it. And we can't sit aloof for these things to happen. We have to be careful because the recommendation was that they need a medically qualified scientist or laboratory physician to come and head the department. So their posting, as I'm showing here, does not indicate they are coming to head a unit.
Exactly.
But it's only somebody who does not look into the future, knowing the recommendation that exists and what they are bringing them, the medically qualified hematologists, to come and do over there. Fast forward, as we are speaking, the college has brought the checklist for that same department to redo the accreditation they had done in 2012. What are they telling us?
So Doc, from what you have put out, at least, please let me come in briefly. From what you have put out, you clearly state that that memo that you got is not saying that these two hematologists are coming to head the department currently, but you are seeing into the future that that is going to happen. Hence, the decision you are taking now. Is that what it is?
So it's not about somebody seeing into the future. Look at the objective for training the lab.
But that's what you just said.
The general objective, I've shown you, that's the 1.4. What is the 1.4.3 saying? The ability to establish and or manage a laboratory. These are the people they've brought. You get it? They've passed out, they brought them. What is the objective? Look down over here. How many are they hoping to train and where are they going? It is estimated that we will require a minimum of 250 laboratory physicians to provide minimum service in the teaching hospitals, regional and district hospitals. They are going all the way to district hospitals. This is the curriculum of the Ghana College of Physicians and Surgeons. Okay. And you bring two of these people to deal with a recommendation, and you think that we should sit aloof because you didn't state their mission and purpose over there is to come and head laboratories. Okay,
let's bring in Dr. Yankson. I have questions we need to get into, but they won't sit aloof because they see they can read in between the lines in terms of what it exactly we are hoping to achieve when it comes to this.
My brother, take it easy. I think you are confusing and mixing the issues out for everybody. Did you hear him? He said accreditation for training of medical specialists, medical doctors and specialists by the Ghana College of Physicians and Surgeons. How can you train a specialist medical doctor, i.e. a laboratory physician, without the supervision of a clinical hematologist? How can you train a surgeon without the supervision of a surgeon? How can you train a plastic surgeon or obstetrician without the supervision of an obstetrician? You see, the fact that a college, which is a specialized institution put in place by law to train specialized medical personnel for certain high-level specialties that as a country we don't have enough. If they come in to do an assessment of a facility which intends to be a training site, and then they make recommendations of some of the minimum level of personnel in terms of their standing in the profession or their expertise, and then other logistics that will be needed. And then they also tell you what, as a country, if we want to provide quality healthcare service to our people, the numbers of, let's say in this case, clinical hematologists who should be trained to ensure that Ghana as a country delivers special and very high-level medical care to its people. Don't forget that as a country, we are trying to even position ourselves as a hub for medical care in the sub-region. What is wrong with a clinical hematologist being at a district hospital? There's nothing wrong with this. This is to ensure that we don't have all of them concentrated in the teaching hospitals, such that when you are sick in my village somewhere, you have to travel all the way to Accra just to come and have your hematological care. So my brother should not confuse the requirements for a training site for doctors. And these are not medical students. These are doctors who have already passed out of medical school and are specializing. So they need a certain minimum qualification in terms of your medical standing for you to be able to teach them. Look, a non-clinical hematologist is not allowed by law to treat lymphoma, leukemia, or a myeloma. So if you are going to train a specialist in that area who will have to supervise this person, is it not somebody who by law is allowed to treat those diseases? And this is where my brother seems to be putting all kinds of issues together and muddying the waters, and in the process misinforming the people of Ghana. Well, it is as simple as that. Okay, so 3 key issues that comes up: who regulates, who works in the lab, who is supposed to be in the lab, amongst others. But let's get into the questions at this point, because it looks like we're leaving the audience out of this. Let's get into the first batch of questions. So Kay has a question for the NLC. Unfortunately, they are not here with us, but he says, ask the NLC why it delayed to call the feuding faction when it was just CAF. Why did they wait till it became a full-blown strike across the country? That's Kay's question. We'll get into the next one. Let's get a few of the questions, then we can. Fred says, why are we in this situation when a committee was put in place to look into it and gave recommendations? What happened to that? Fred is asking. FA says, what exactly has been the input of the Ministry of Health? Because as far as I can remember, this has been going on since 2013. It doesn't look like much has been done. That's FA's question. Echo on Facebook says, this is to the med labs. Why is there a need for recognition when in fact no one doubts their credibility? Supremo says, isn't this just a subtle power struggle within the GMA? Sam says, is it true the GMA condescends the med labs? And maybe the final one for this batch: if the doctors are posted to the lab and not to head the place, are the laboratory scientists ready to work with them? Please ask the doctors if they are ready to work in the labs without being made the heads or leaders. This is a question to both, and we'll get responses. Maybe we'll start on Zoom with Dr. Dennis Edujesi. So they're asking why we don't doubt your credibility. So what exactly is the concern? And then also, are you ready to work with the lab physicians if they are not supposed to be in the headship? And that question is also vice versa to Dr. Yankson. So you can take those two quickly, then we can take more questions.
Yeah, Emifa, I think we have always made it clear. Until recently, we have people who come to the lab. I have worked in St. Patrick's Hospital in Marcy or Finso. Instances that I will leave the lab, go to the consultant room, have a discussion with the doctors. Dr. Maxwell can come at that time, Dr. Tony Davo, and they have instances they will also come to the lab. We'll go to the ward. You do several other things across. We don't have that kind of problem at all. But it's just about this situation and what the intention is. You know, the point is that, Dr. Jansen, this is, MFI, you started by 2013, we have a policy document. that has been kept on hold up to now.
And there's no policy.
By who?
This is the review by the Ghana College of Physicians and Surgeons. The policy document.
There's a policy document?
These documents have been approved. They are ready to be used in Ghana. And it's been kept on hold since 2013. Simply because...
So you're talking about the National Health Policy approved by who?
Oh, by the ministry. Look at it. Sharia at that time, Dr. Apia Dentra. These are the documents. We have 3 of them. The National Health Laboratory Policy, the accreditation, and the strategic planning document. With an investment of 1.5 million cedis by the CDC, ready on bench, ready to be. It was 2013 in September. That it was going to be implemented. And simply because of this, look over there, the policy statement. When the Ghana College of Physicians and Surgeons, I can show you the letter from the rector, had indicated to then time Dr. Apia Dentra that they are stakeholders, which, in fact, they were part from the initial. I can show you the attendance over here. Prof. Alex Bruce Tego, Ghana College of Physicians and Surgeons. This is that's 2009, 2010. They were all part of the processes. Meanwhile, at the end of the day, they are saying that they were not consulted. And for that matter, this particular thing will have to be captured in the policy that is ready. If not, the policy is never going to be allowed to be launched and implemented. Simply because the point C, laboratory services at all levels shall be headed and managed by a qualified laboratory physician. It was initially laboratory professional with current registration by the relevant regulatory body. Then they go and change it, track changes, Ghana Medical and Dental Council.
Who changed it? Who changed it? Who changed it, Dr. Dennis Edugesi?
The Ghana College of Physicians and Surgeons, in track changes. I will send you this document. In track changes, the Ghana College of Physicians and Surgeons. And in the same vein, the GMA support their position.
Okay.
When they went to IET's committee, that the lab should be supervised by the lab physician.
Okay, so like I said, we need to give quick responses to some of the questions. So the second part you haven't responded, whether you're willing to work with them in the lab if they are not supposed to be heads or leaders over you.
I've told you we are already working together. We are already, so there's no problem with them at all.
But then why are we on strike? If you are working with them and willing to, why are we on strike then? Because that's the situation. Why are you sucking them out of the place?
MFA, we will get to the point of the GMA's release. You go and listen to the PRO of Kompanochi Teaching Hospital. These people are not even in the lab physically. You get it? They are not in the lab physically. They
okay, so like I said, let's get quick responses. Dr. Yangsing also, there's the question for you. Is it true that GMA condescends the med labs? And it looks like it's a power struggle with the GMA. Is that what it is?
No, there's no power struggle within the GMA.
You're sure?
No. This is not about the GMA per se. But what they are doing now undermines a certain portion of medical practice. That is the work of a laboratory physician. I think that we should also take the time to educate people about the work of the laboratory physicians. Look, sometimes they are described as the doctor's doctor. They are the people who provide us with a lot of technical backing to ensure that the right treatment is given to the patients. When you work in the lab, I have worked in the lab before. I worked at the hematology department in Kolebu.
Okay.
For 2 to 3 years. A lot of my good friends in Kolebu are the people from the central lab. I used to work with them. The hematology department, we used to do our bone marrows, we used to do our slides, we read them. A lot of them are my good friends. We shared offices. So as far as we are concerned, we don't have any problems working with them at all.
Okay.
There are people, if you go through the records, in the early 80s, thereabouts, Professor Swanika was not a medical doctor. Professor Safo was a medical doctor. But Professor Swanika was the head of department for the laboratory, chemical pathology. There's no problem. As we speak, the person who heads Kompanochi is a non-medic, the laboratory. We don't have a problem. So we are not concerned about headship. Like we stated, if it's about headship, it's up to the management of the organization to look for the right people with the right competencies to do what they have to do.
Okay. Well, let me bring in Dr. Nana Ayew Efriye also on this, because there are some concerns about this going on. It's been on since 2013. It doesn't look like much has been done. What exactly has been the input of the Ministry of Health? There's also one on why we are in this situation when a committee was put in place to look into it and give recommendations. You are closer to the Health Ministry than we are at this point. I'm sure you've been finding out what exactly their input has been, knowing that this has been going on since 2013. We've heard about a policy document that Dr. Dennis Edujesi is making reference to also. What exactly have you been able to glean when it comes to what exactly the Ministry of Health is doing about this situation?
Yes, MFR. I think that if you look at the fact that there's a shelved national laboratory policy, there's also shelved a national strategic plan covering 2013 to 2017. If you also look at the fact that it was signed by then a minister, and if the policy document is not being used, then obviously there would be a reason. By virtue of the discussions, I've also taken note that there's an IET committee that was commissioned by Mr. Segbefia, who was then the Minister of Health in 2016. And so by continuity of governance, then obviously the backstops with the Ministry of Health. And it's supposed to be a clear decision on their part, where the policy document is, if it's going to be used, and what are the recommendations of the other committee. Why did they do another committee to oversight that? And what are the recommendations? And are we going to come to a middle ground? MFR, we mindful of the fact that we provide oversight in the health sector. And we are going to get the Ministry of Health to represent. Now, as of why it's taking over 3 years after 2016 of, let's say 2021, say 5 years after 2016, they have questions to answer. I think the Ministry of Health has questions to answer to the Select Committee on Health, and that is probably the reason why we need to calm tempers. Dr. Dujemfi on the other side has to calm down. Like we have told them, Doctor, you need to go back to work and let us iron out these issues. Ebo, my brother on the other side, also definitely would have to also calm down. At this point, everybody's trying to be assertive, and being so assertive means that there's going to be the continuity of everybody keeping their turf and then being stronger on it, and no middle ground. We should get to know that whatever we do, we are doing it on behalf of the people and for the people. And so for that matter, entrenched stance is not going to help the Ghanaian. Ultimately, who are you serving? You are serving the Ghanaian interest. I think they should have to revisit their posture as they come to the committee on Tuesday. And obviously, I think there will be a truce. MFR, we will get a way out of that. And I think that it's been so much a delayed process. The ministry should have acted. If indeed the IET committee brought its recommendation in 2016, and if indeed there was a policy document in 2013, regardless of which government is in power, ministers of the past are now equally responsible for what inactions and actions would have kept all this. And so for us as a health committee, we don't know an MPP government, we don't know an NDC government. All we know is that the Ministry of Health is a policymaker. What is the situation? And I think that we would come to a middle ground on this issue.
Okay.
But I would entreat my colleagues to calm down.
Okay, so I know you mentioned earlier that you're talking to all sides on Tuesday. Are you holding the Ministry of Health to Parliament on this, or to the Select Committee? When exactly will that also be done? What are the timelines? Because it appears that nothing much has been heard from them.
The clerk will send in the letters tomorrow, God willing, and we are not asking of them by virtue of the standing orders of the law. We are informing them to be available on Tuesday, and they will come. The minister will come. Everybody will come. That is the point. I mean, at this point, the people's power would have to prevail.
Okay.
And that it's vested in oversight committee, and we are asking them to come, so they have to come.
But whilst we wait for that to happen, today, for instance, the Ghana Medical Association has come out with a communique, a number of resolutions, interesting resolutions there.
Hello?
If you can hear me, I'm saying that whilst we wait for that to happen, the Ghana Medical Association, okay, it appears that Dr. Ayew is unable to hear me, but we'll try again once we return from this break. But I've been talking about the Ghana Medical Association and that resolution, 7-point resolution. Among others, they say when push comes to shove, the GMA and its members may be forced to reject laboratory results without authorization by qualified laboratory physicians at a point in time. We've seen this happen in Nigeria as well. They've also mentioned that the GMA is calling for a broader stakeholder consultation to look at the draft national laboratory policy. I'm sure that's the document that Dr. Dennis Edujesi was making reference to. They've also been talking about the assault, all other forms of threats, including but not limited to murder and bodily harm, harassment and assault directed at these laboratory physicians, residents and specialists should cease forthwith. It goes on, but we'll get into it after this break here on The Probe. Here on The Probe on the JoyNews channel. We're also live on Joy 99.7 FM, Love 99.5 FM in Kumasi, a dozen affiliates. We're also on myjoyonline.com and a dozen social media platforms as well. And we see your comments. Thank you for sending them in. My guest tonight, Dr. Justice Yankson, with me in the studio, the General Secretary of the Ghana Medical Association. Dr. Dennis Edujesi is with me via Zoom. He's the PRO of the Medical and Laboratory Scientists. And then also we've had Dr. Nana Ayew Efriye. He's the chairman of Parliament Health Committee. Was unable to hear me earlier, but we'll try and see if we have him back with us. But I was talking about the resolutions as put out by the Ghana Medical Association earlier today. So amongst others, there are concerns about threats on their members. I'll have Dr. Dennis Edujesi respond to that. But interesting, I see the draft national laboratory policy and calls by the GMA for a broader stakeholder consultation on that. Is that the same document Dr. Dennis Edujesi was making reference to?
As far as I'm concerned, yes. You see, from what Dr. Ayew Efriye said, that since 2013, this document hasn't seen the light of day.
Why?
It has transcended different governments, different health ministers. It tells you clearly that there's a problem. And that's what he said. And he hit the nail right on the head. The development of this particular document was actually skewed by the Medical Laboratory Scientists Group working together with the CDC, basically eliminating the others.
We also heard him mention that you're also making some changes.
No. Hold on. We cannot make changes to a document. If you have a proper document, which is a national policy, how can somebody go and make changes to a document? It is what you are seeing are some of the things that came up when all other cadre of stakeholders, other than the Medical Laboratory Scientists Group, realized that the content of that document was going to be disastrous to the practice of laboratory, to the laboratory practice in Ghana, as well as healthcare delivery in general. The other stakeholders who were all alienated to a large extent, for which reason their inputs and the sort of things that they do within the laboratory space were not captured, raised red flags. If you care to know, somebody like Professor Abraham Anand, who is the head of Noguchi at this point, wrote a very beautiful letter detailing the negative effect that this policy will have on Ghana. He was not talking for GMA. He wrote it to the minister. We all have copies. The other stakeholders raised issues. So at that time, they were said that no, if all these issues have come to the fore and it was not going to inure to our benefit, because even the development of the document itself alienated a lot of the stakeholders, then it will be good for us to have a quick overview or a review of that document for all the stakeholders to make the necessary input, so that at the end of the day, when we have an acceptable national policy, it will truly reflect the name.
After that letter, that did not happen?
No, what I'm saying is that when these things came up, stakeholders who were alienated came to the fore and actually pointed a lot of things out. As we speak, the biomedical scientists who were originally part of the medical laboratory scientists group, have actually been forced out of the laboratory space by the same medical laboratory scientists. These biomedical scientists, together with the laboratory physicians, but of course led by the laboratory physicians, were the ones who established the true structures for training medical laboratory scientists in Ghana. People like Professor Akwe, Professor Redu, Bruce Tego, even Professor Akose and all of them. Around 1980s, the school was offering just certificates. It was this same laboratory physicians that today they say they don't want them in their labs. They, working with some biomedical scientists, actually set up the structures and moved it from a certificate awarding facility or institution to a diploma, and finally to degree, and then to master's, MPhil, and now it's a big structure. You can go to Kolebu and look at the school. The records are there. What it tells everybody is that there are others who have also been in the clinical space. It is not only medical laboratory scientists. We have biochemists who also work in the labs. We have biologists who work in the labs. We have microbiologists, we have hematologists, we have chemical pathologists, immunopathologists, those in molecular genetics, what have you. So there are various groups of persons in there. But our brothers want to claim that that space belongs to them and them only. And that the people who even train them and nurture them to where they are now have no space being in the laboratory.
Okay.
When these people were actually there. Look, the practice of laboratory medicine started in the 17th, 18th centuries. As far back as 19th century, it was a well-recognized specialty in medical practice. Until date, the importance of the laboratory physicians when it comes to managing cases by the clinicians, their importance when it comes to research can never be underrated. We have a very specialized institution called Noguchi. Let me tell you how Noguchi came about. A medical doctor called Noguchi from Japan, who was interested in laboratory medicine, that was his specialty, came to Ghana to research into yellow fever. He has a place in Kolebu and the name after him here. It was in the process of his work that he contracted yellow fever as well and passed. All I'm trying to say is that as far back as even 1922, doctors were practicing laboratory medicine here in Ghana. So if somebody comes up today to put up these things, it's an non-starter. This draft national laboratory policy, as he referred to, is something that nobody can really work with it if we want a true national document. That is why it has never seen the light of day.
Okay.
They should accept the wrong that they occasioned in that document, for which reason the stakeholders raise the issues. The ministry, in its own wisdom, like I said, it has transcended different government, different ministers, also noticed that there's going to be a big harm. And I've told you letters that eminent persons in the laboratory space have actually come up with.
Dr. Yankson, let's bring in Dr. Edujesi, because he made reference to that policy document as well. You would have to unmute Dr. Edujesi. So they are asking for a broader consultation to look at this draft national laboratory policy that you talked about. It's been in existence for a while, but we are unable to use it. You've heard Dr. Iwefrie also make a mention of that. Do you agree to a national or a broader consultation on this? Can you hear me?
Yeah, I can hear you.
So I'm asking if you agree to a broader consultation on this. We are really out of time, so we'll have to tackle the issues head on.
All right. Quickly, Dr. Yankson, the policy is not a draft. So GMA, in your current release, you made a mistake.
Why haven't you implemented it? If it was a true policy, why is it not being implemented? I am telling you that as far as the stakeholders are concerned, this is a draft national policy.
Professor Plandreau was present as a stakeholder. Professor J.T. Anip was present as a stakeholder.
You sidelined all of them at some point. I'm putting that to you.
As a stakeholder. Usu answer, Dr. Justina answer. Then you come here, Professor Alex Brooks Tego.
How many times were they part of the meetings that were held?
People,
it wasn't just one meeting that you picked and you are parading around as if that is what went into the development of the document.
Okay,
where were their input into the preparation of the document?
Dr. Yankson, Gentlemen, so Dr. Edujesi, I'm asking a specific question. You agree to a broader consultation on that document because it hasn't been implemented, it hasn't been used over the period since 2013. You agree to a broader consultation on that?
Emepa, this is, if we even go for another stakeholder meeting, that will be the third time. We are all ready because we need this document to work as a nation. I can show you copies of letters to appear at that time by the college, threatening. You get it? This is the letter. This is a letter from the College of Physicians and Surgeons to the minister at that time.
Okay.
Professor Dr. Abiyadunsa. What is the content?
So you are not against a broader consultation, even if it will be the fourth time.
We don't have a problem at all.
Okay. So there are also some key concerns they raised.
That they have not been the one at the back of it trying to cause all these problems.
Okay, and in going forward, Dr. Edujesi, they raised concerns about forms of threats, assaults, not excluding murder, not limited to murder and bodily harm, they say. How do you respond to that? Has that been brought to your attention? Is that what exactly that is happening? How do you...
I think that's quite unfortunate. And for me, Dr. Yankson is a lawyer. So if there is any criminality in this sense, let the people report and pick them up. We can't deal with recalcitrant. So if any, but I know lab scientists are that gentle, they are never going to that extent. But if there is any, report to the police. I think that is quite appropriate.
Let me help you, my brother. Let me help you. In 2016, these reports were made to the Kolebu police. You can go there for the records. They came to the facility all I'm trying to let him understand is that this behavior didn't start now.
Okay.
And if he says he should report, I'm telling him that we have already reported.
Okay.
And that is why we are calling on the Ministry of Health and the Ghana Police Service
we can't hear both of you at the same time.
Prosecution of the people involved.
Okay.
So I want him to understand that
these are recent threats you're saying.
What I'm saying is that
as a result of this strike?
Please, the threats have been there. It's not limited to now.
Okay.
Just the last couple of days, Professor Ekem and her team at Cape Coast, the same thing is happening to them. And I'm saying that if he's talking about reporting to the police, I'm telling him that he can go to the Kolebu police station. The records are there. The reports have been made. The police have come to the site to investigate, take samples and what have you. Except that the prosecution and the due processes with the law hasn't happened. Okay. And that is why the GMA is calling that the right things be done.
Yeah. So I have just a minute. Dr. Edujesi, going forward, Dr. Edujesi, I have just a minute to wrap up. So I would want you, the entire country is listening. We've established that you don't have a problem working with the laboratory physicians. There's no problem. Actually, it's not the issues of our head. So going forward, you are on strike. What exactly would it take for you to go back to work? Because everybody is asking that you go back to work whilst the talk goes on.
I think it has been so simple, so clear. If my screen could have been shared, this is GMA's statement to AITE's committee that the lab physicians are allowed to provide supervisory support. What are they going to do with supervisory support? Then Dr. Yankson is telling us that's not their duty.
You haven't given us the way forward, Dr. Edujesi. We are out of time.
Edujesi, your comments are false because I represented the organization. The GMA never made those comments. I am telling you on record that your comments are false.
It's about you trying to supervise laboratory science.
You don't know the role of the medical laboratory physician. Just go and educate yourself on those bits.
No, check in the law. The law.
What is the law? Now let's come to the law. You go about talking about the Allied Health Professions Council. And you are just sharing a falsehood by way of interpretation to the people of Ghana.
Okay.
Go and educate yourself on proper interpretation. The law never says that anybody should be registered by the Allied Health Professions Council if that person is a medical laboratory scientist.
And that's how we wrap up tonight's edition. That's how we wrap up tonight's edition of The Probe here on the JoyNews channel, also on Joy 99.7 FM. For Joy FM listeners, A Walk with Jesus is up next shortly, but I'll be back shortly. We'll look at the ECOWAS summit, and my colleague Elton Brobe will give us details. I am MFA Paul. Thanks so much for your company tonight.